Hello everyone, I am Dr. Anubhuti Dhanuka, Consultant ENT Surgeon at Chikitsa Hospital, Amritsar. And today, during this National Hearing Week, I would like to talk about a very important topic, pediatric hearing loss, that is hearing loss in children. Hearing is the key to understanding the world, to listening, to speaking, and also in social development. So 1 or 2 in every 1,000 children around the country suffer from some kind of hearing loss during their lifetime. But early detection and its treatment can help change the life of the child. What are the causes of hearing loss? Hearing loss can be present since birth, that is congenital, or it can be developed later in life, that is acquired. Congenital hearing loss can be because of some birth complications or some structural abnormality in the ear. Acquired hearing loss is mainly because of any infections, any meningitis, any blockage in the ear because of earwax, or any adenoid growth behind the nose, that is adenoid hypertrophy. So how can we diagnose this early on? Firstly, we have to see the signs in the child. A toddler or a newborn will not startle on hearing a loud noise. They won't go or they won't look towards a source of noise, and they will have a delay in their speech. As the child gets older, they will also have difficulties in speaking, that is delay in speech, and also they will have difficulties in the school. They won't be able to understand the teacher and thus not perform well at school. They can often listen to the TV at a very high volume, which should indicate to the parents that the child might not be able to hear properly. At this stage, they should definitely visit an ENT surgeon. So how can we diagnose the hearing loss early on? In younger children, that is in newborns and in neonates, we do testing called as BERA or OAE. And in older children who can understand us better, we can do a simple test known as pure tone audiometry. Along with this, your ENT surgeon will also look at the ear of the child to see if there is any wax or the blockage, and sometimes we might look at the adenoid hypertrophy of the child. So what are the treatment options? In congenital hearing loss, if the hearing loss is moderate, the child can just go for a hearing aid, and if it is severe, the surgeon might suggest a cochlear implantation. For infection, it can be treated accordingly. Earwax can be removed by the ENT specialist, and adenoid can be treated either by medicines or by surgery as required by the child. Along with this, prevention by the parents is very important. They have to keep a watchful eye towards hearing loss. The child should avoid loud noises exposure. They should avoid ototoxic drugs, that is drugs which can hamper the hearing of the child. And if the child is suffering from any cold, mouth breathing or snoring, they should definitely visit your doctor and get it treated as soon as possible. So finally, I would just like to spread this word among the parents that hearing is very important for the child to listen to the world around them. Any problem with the hearing in your child should be diagnosed and treated early on. Thank you so much for watching this video. Let's spread the awareness and help every child hear the world.